Okay, the female reproductive cycle drugs, pregnancy and preterm labor drugs, we're going to briefly go over. Before we start, I want to backtrack to pre-pregnancy and birth control. A really big important thing for nurses to know is that birth control pills increase the risk for blood clots. So when people are taking those, they need to know about that, but you also need to be watching that. I did have a patient with a blood clot in her foot who was about 23 that was on birth control, had come in for a minor surgery and had problems with that. It's even higher with smoking, though. So the combination of birth control pills and smoking is really bad. So women should know that there is this risk and that they should stop smoking if they're going to go on birth control pills. Or if they're going to continue smoking, it's really contraindicated to be on birth control pills at that time. Then we want to also talk a little bit about emergency contraception, things like Plan B. These are done in the first 72 hours of after conception, and if it's done anytime beyond that, it does not work, but it can harm the fetus. So we really need to know when they believe that they may have conceived. That being said, let's move on to the female reproductive cycle and the drugs associated with that. Reproductive hormones, so we deal with the follicle stimulating hormone and luteinizing hormone, and you can look through this and review the female reproductive cycle if you'd like. Prenatal drugs that are used are iron, folic acid, and prenatal vitamins. Very important for all women to have folic acid and prenatal vitamins. Iron will come recommended by the physician only if that individual needs it. To know for, as nurses, alcohol abuse can make one severely deficient in folic acid. We really need to educate people about not using alcohol while pregnant. So drugs taken during pregnancy can include things like Zofran for nausea and vomiting. We use it a little bit less now because we do know that it has more side effects than we thought it did. For nausea and vomiting, though, now it's really recommended the doxylamine and the B vitamins. Ginger may also be used. When they have heartburn, sucralfate or carafate may be used. So discomforts that are associated with pregnancy, people will use Colace. That's okay. They need to be talking to their doctor, though, if they're going to be taking anything. Metamucil. So Tylenol is okay during pregnancy. Aspirin and ibuprofen are not okay during pregnancy. And in fact, ibuprofen changes into a category D in late pregnancy. And it can actually cause premature closure of the ductus arteriosus. So other things that can be used during pregnancy, you'll discuss more in when you are in maternal child in that class. But preterm labor, you do need to know a little bit about. We do give dexamethasone or betamethasone for that. We need this for surfactant production in the premature infant. Gestational hypertension, preeclampsia, and eclampsia. Gestational hypertension is most common hypertension during pregnancy. Preeclampsia is that gestational hypertension plus proteinuria. And then eclampsia is that gestational hypertension, proteinuria, and sometimes you will see a grand mal seizure. Labor, delivery, and preterm neonatal drugs you'll also see in your maternal child class. But epidurals and spinals are often used. Pitocin can be used to induce labor, and prostaglandins can be used. Things like cervical gel can be used as a vaginal insert to promote labor. After delivery, methergin can be used to control postpartum hemorrhage and promote uterine contraction. Baby's lungs, we talked about synthetic surfactant. We talked about a little bit of the mom taking steroids if the baby's going to be born early. Now, this is after baby is born. Synthetic surfactant can be used after the baby is born. Postpartum and newborn drugs. Now, once postpartum, the NSAIDs are okay. Opioids are okay. Epifoam is used in the perineal area, and witch hazel and dibucane ointment can also be used. So the RH factor and childbirth, there's a problem when mom is RH negative. And the first child, if RH positive, will cause that RH mom to make antibodies. So once antibodies are formed, these antibodies can attack the next baby and break down the baby's RBCs, making a hemolytic state in the blood, causing serious illness, brain damage, or death to the fetus or newborn. The antibodies are referred to as D antibodies. So when mom is RH negative, if there's a risk of exposure to that baby, Rogam is given to prohibit D antibody formation. Again, the lovely female cycle. So when you're working on birth control pills with a patient, again, you want them to know their antibiotic is going to make their birth control less effective. They need to know they're at increased risk for blood clots. They can't smoke while they're on it. And if they're going to utilize emergency contraception, it must be done in the first 72 hours. So sometimes estrogen will be used in the therapy. Excess estrogen effects include nausea, vomiting, dizziness, fluid retention, breast enlargement, tenderness, chloasma or melasma, discoloration of the skin, BLE cramping, bilateral dry eyes, changes in vision, and in the cornea, and headaches and hypertension can ensue. Too much progestin we can see weight gain, increased appetite, acne and oily epidermis, depression, vaginitis from yeast, breast size reduction, and up to 2% of patients will experience amenorrhea after stopping the use of a pill with progestin in it. Menopause is a state that's not so fun. So there can be perimenopause, which is really kind of premenopause, menopause, and postmenopause. So bioidentical hormone therapy, plant derivatives can be given, which are pseudoestrogens. Some of them are herbals, so they aren't really controlled by the FDA. Some of them are actual products coming from different pharmaceutical companies. So, hormone therapy can be used. Osteoporosis is something that occurs when a woman is older and their hormones change. And so they no longer hold the calcium in their bones as well. Prevention of it, we can take calcium and vitamin D. Make sure that we're doing weight-bearing exercises. Meds that can be given are Evista, Forteo, Fortical, Miacalcin, Prolia, Fosamax, Boniva, Actonel, Reclast. Foxamax is one that we give pretty often. It's given early in the morning, and the patient has to sit up for a while, just because there's some GERD associated with that too. So, and to make sure that that one goes down. Men's health disorders, we look at the use of testosterone in hypogonadism or delayed puberty. These are anabolic steroids. Sometimes people will use them as muscle builders. Examples of these include leuprolide, flutamide, and in an indirect way, ketoconazole. They can be used for prostate issues, endometriosis, male pattern baldness, acne, early boy puberty, and hirsutism. So these are actually anti-androgens. Examples of these are the leuprolide, the ketoconazole, and the flutamide. So these are anti-androgens. Erectile dysfunction, sometimes Viagra is used, also called sildenafil, or Levitra, or tadalafil, which is also Cialis. These ones are the ones that you want to know if somebody is taking them when they come in with their chest pain, so that can be known, because then we can't give them nitro. And also you'll see little old ladies taking the sildenafil to open up their vessels in their lungs. So it not only works on the vessels in the penis, it also works on the vessels within the lungs. Benign prostatic hypertrophy. Things that we give are things like Proscar, Propetra, Avidar, Flomax, Cardura. Cardura is known as doxazosin. Flomax is known as tamsulosin. And I really want you to know this. Remember this. Don't forget it. If you are of childbearing age, wear gloves when you're administering these. Some drugs for disorders in women's health, infertility, and sexually transmitted infections. So there's sometimes irregular or abnormal uterine bleeding, and then we move into amenorrhea. So there's primary and secondary amenorrhea. Primary amenorrhea, no menses by 14, no secondary sex characteristics by 14, no period by 16. Secondary is no period for 6 months after having already had some periods. Polycystic ovarian syndrome is basically too much luteinizing hormone. People end up with excessive weight, especially around their middle area, and some insulin resistance. With this, metformin can be used to reverse the polycystic ovarian syndrome. Uterine bleeding problems include menorrhagia, metrorrhagia, anything that's an arrhagia. So Mirena and Depo-Provera are commonly helpful with these. With dysmenorrhea, we talk about pelvic pain and NSAIDs, contraception, different ways that we can approach that excessive pain. Meds for vulvovaginal infections include things like Monistat for yeast, for bacterial vaginosis, Tindamax, or Flagyl can be used. Female infertility, so there can be ovulation difficulty, luteal phase deficits, it can be very individualized. Male infertility, oligospermia, athenospermia, and testosterone can be talked about with male infertility, and a focused treatment plan can be done individually